I am definitely prepared for anything, but I suspect the people around me do not really need any doctors at the moment, luckily, but we always need doctors and we know it well. It's one of the most important skills out there. Now this particular skill area is called health and social care, and the name speaks for itself. It's also a very ancient skill if you think about it, because it dates back to the ancient Greece, and one of the first persons to actually introduce proper medical health care to the humankind was obviously Hippocrates, who laid the scientific foundations of what we know today as medical science. His famous oath sounded like "do no harm," and it's still taken by all the doctors and medical workers across the planet. The term Sister of Charity, or the Daughter of Charity, was proposed by the French priest Vincent de Paul, who organized the first community of Sisters of Charity in 1617, also a very important milestone for medical workers. And the first nurses had no professional education, believe it or not. In Europe, servants in churches and nuns assumed this role. Also worth mentioning that nursing care originated within the traditional model of care of people, and the English nurse Florence Nightingale, a very famous nurse I should say, laid the foundation of what we know today as professional nursing. Now we have this stand here, a lot of people are walking about asking questions, and this is obviously the time for me to ask questions, and I introduce here Sabrina de Curtens, Chief Expert on Health and Social Care. Thank you so much for being with us. Thank you so much for coming to Kazan. Can you just tell us a little more what's exactly going on here at this skill area?
Okay. So, as you said, the health profession is very good, interesting, and I think it has to grow because there's so many people getting older, and we need a lot of carers and nurses. This is health and social care, so it's about nursing and caring. So we have some social carers and we have some nurses. So it's kind of a mixed profession group, and they have different settings. We have the hospital setting, which is very known, but we also have a home setting, like people going at home to the patients. We have a daycare, which is a daycare clinic, and the third one is residential care, where the people stay for a longer time. So in our skill, you can see all the settings where health and social care can happen. Yeah, and they have different modules where they just do what they do in their work, and we just have actors which play the roles for patients.
Right, so patients are not real, those are actors.
No, they're not. They're actors. They're actually young actors, and we made them a little older. We had to make up them. So.
Sabrina, World Skills is obviously about a competition.
Yeah.
Can you just explain how exactly these competitors here compete? How do they best one another?
Yeah. Well,
Sabina, I'm sorry.
that's okay. We have different fields where they are tested, and in our profession, communication is very important. So it's about 30% communication which we test, 25 to 30%, and the rest is also technical stuff like how they do blood pressure measuring, how they do wound care, how they show people how to walk with a cane or something like that. So it's like a quite variety in our skill. You need to have some technical knowledge and also some procedure knowledge about hygiene and about how you really do it so it's safe for the patient, but also a lot about communication, instruction, caring, like taking care of them, give them some empathy, some emotional support in their situation.
Right.
Yeah.
When we just came over to this skill area, you were swarmed by people asking you questions. If you don't mind me asking, what were they interested in? What's on the minds of the people here asking you?
Yeah, well, it's the first day, so it's always first day we get to be organized also in our skill. And as you see on our time plan, it's tough on my experts to assess it because we life assess because they do things. We have criteria. We discuss the criteria really good, so we have good criteria and we take, okay, do they do this, do they do this? And so mostly today they just ask me about how the organization is. But if people come, I think they're often surprised that health and social care is not only about bringing people to the toilet or washing people, it's more about like getting to know their whole situation, their problems they have with coping with diseases, for example, or like have to change their lifestyle because they have diabetes or whatever. And also, yeah, it's just much more. And a lot of spectators are, yeah, they're surprised about it because our profession is still not known, or people just have these common ideas what nursing or health and social care is about. They think we're just washing and cleaning beds and so on. And I mean, that's
But
also
it's far more
important.
complicated than that, right?
It is important, but that's just like a small like slice of the whole skill.
Right.
And also, there's a huge variety what they can go into. You can go into more technical fields like operation, anesthesia, and so on. But you can also go into residential or in occupational fields. So it has everything for any personality in it. You just have to like to be with people, to care for people, and to study a lot. There's a lot you have to know about the diseases, about the caring, about the techniques of nursing or health and social care. So, yeah, and we professionalized our skills since the start a lot.
Since ancient Greece,
Yeah.
yeah. Thank you so much, Sabina. That's all we have time for. Thank you. I appreciate your input, and I'll be back from the next skill area in a bit, so see you then.